Joining us now to weigh in is Dr. Vin Gupta. He's a pulmonologist and affiliate faculty at the University of Washington, also advises big companies like Amazon. Dr. Gupta, do you agree with this new guidance? Does the research back it up?
Sarah, thanks for having me. We'll get to be able to speak to you guys. I do. I think what's interesting is that it applies to everybody and not just the fully vaccinated, which is where I think you might have some disagreements arise in the public health community. What we do know is that even if you test positive and you have a case of a breakthrough positive test after you're triple vaccinated, you're either asymptomatic or have mild symptoms, but that you can test positive, and that positive test can go away within, say, 72 hours. That does not necessarily apply to somebody who is unvaccinated, Sarah. And so the kinetics of the virus in an individual who is unvaccinated are very different from those that are triple vaccinated. So I do think that this is a great move for individuals that are fully vaccinated, as defined by 3 vaccines. And yet for those that are unvaccinated, this will be met with some confusion and I think some disagreement in the public health community.
Why this change now, do you think, Dr. Gupta? Because clearly, for a long time, the rule has been 10 days. Now we change it to 5 days. Might it suggest to some that the isolation period was always too long, or has it got something to do with the current dominant variant being less severe?
It's multifactorial. I'll say we're learning as we're going. What we do know is if you're triple vaccinated, that even if you test positive, that your infectious period is very, very limited. So within 72 hours at most in many cases, especially if you're otherwise healthy, lack serious underlying medical conditions like cancer. So this is a good move for individuals who are triple vaccinated who might get exposed, especially now we're realizing that breakthrough cases are all around us, that this is going to be the new normal, that the goal of vaccination is to keep folks out of the hospital. And so this is an important move, but again, to align with our ultimate goal, which is increase vaccination uptake across the country, get as many people vaccinated as possible. I do think having a separate set of policies for the triple vaccinated and a separate set of policies for the unvaccinated would make more sense and would more greatly align with the science as it is today. So what I just mentioned does not apply to the unvaccinated. And again, I think that's where you're going to see disagreement in the days ahead.
So you think it should be, if you're triple vaccinated, then 5 days after a positive test, you're good to go. But if you're unvaccinated, it should be 10. That's what you would have recommended? Something like that?
I wouldn't have changed the guidance for the unvaccinated because, Sarah, what we do know is that those individuals still could be potentially infectious for many days on end. So nothing has really changed. If you're exposed, infected with Omicron, you're unvaccinated. It's not like you're clearing the virus and are not a danger potentially to others and infectious to others only for 5 days. You very well could be infectious outside that 5-day window. So the fact that there wasn't a 2-tracked approach is a little confusing. As we're digesting this new information, I'm sure we're going to get greater details. But this absolutely is the right move if you're triple vaccinated. We have to normalize the concept of breakthrough infections, bring down the temperature when we're talking about it, what it means, because it's going to be much more common. Having protocols in place to help normalize that are really critical, and yet having a different set of standards for the unvaccinated still makes sense. And so the fact that there's a one-track approach here, I think if anything, is going to cause greater confusion.
And just finally, Dr. Gupta, I wanted to get your take on the latest information that we have on Omicron. I guess we've got quite a lot of data now from places like the UK to add to South African data, and now a bit of US data as well. Are you encouraged that it is significantly less severe than Delta?
All this data, Wolf, is early, is what I would emphasize to all your viewers out there. And that if you are unvaccinated, we don't have a lot of great data about what Omicron does in the lungs of the unvaccinated individual. What we do know is that you get more of it in your nose and more of it in your lungs if you're unvaccinated, usually an increased viral load, whether it's from Omicron, Delta, or even, say, flu, generally correlates with increased severity of symptoms. So I am very hesitant to say at this moment that if you're unvaccinated, Omicron is not a big deal. What we do know is that if you're triple vaccinated, Omicron, from all the data we have here, if you have that breakthrough case, it's mild, which is fantastic news. It aligns with why we get vaccinated for a contagious respiratory virus. You get vaccinated, you keep yourself out of the hospital. That's what all the data shows, and that's great consistency for the way we need to start messaging moving forward.